I'm Rafi Mirzayan from Los Angeles, and I'll be demonstrating a bone marrow aspiration from the proximal humerus for a augmentation of a full thickness rotator cuff tear. We have a right shoulder here, and my starting point for the bone marrow harvest is going to be just off the edge of the acromion, and I can localize that with a spinal needle. And my starting point is going to be just posterior to the biceps tendon off the articular margin, where you would typically put your anteromedial anchor for the rotator cuff repair. Now, typically, the entry point of this trocar has been at a 45-degree angle relative to the head, and the harvest is performed from the humeral head. What I like to do is be more parallel with the humeral shaft and advance the trocar into the humeral shaft and harvest the marrow from there. And I typically do this in a lateral decubitus position with the arm abducted at 30 degrees, so it is critical that at this point that the arm is adducted all the way down. You can see how by doing that, that trocar becomes perfectly parallel with the humeral shaft. I prefer to use the vortex needle because it provides better directional and depth control. It also provides a watertight seal, which is critical in an arthroscopic harvest of bone marrow. The vortex needle is then twisted in by hand just to break that cortical bone. And it's also important to note that I did not prepare the tuberosity whatsoever. I left the soft tissue on it. I did not use a burr, and I'm using my hand. We're not malleting this in. We're not forcing this in. We're letting the guide find its way into the canal. And I can advance this as far as I can before I can feel hitting the inner cortex of the humeral shaft, which would be my stop. And you can see how deep we've actually inserted this trocar to be able to get into the shaft of the humerus. All right, so what we can do now is back this guy up, get the fluoro in here, and then shoot to show this is going down the canal. So we've now inserted our vortex needle all the way down the canal of the humerus. We will remove the trocar and attach our Vaclock syringe onto it and push back all the way. Look at that marrow. And it helps if you rotate this back and forth so you can aspirate from multiple sites through the canal. There you go. You see how quickly that aspirated. Once you're done with the aspiration, the vortex needle is removed, and you can now insert your anteromedial anchor into the same hole that you just removed the needle from. So the important note here is that you do not want to do any tuberosity preparation. This includes removing of soft tissue or burring down the bone. It's also advantageous to do this at the very beginning of the case, aspirate the bone marrow, hand it off to the staff so they can prepare it through the angel system, so it'll be ready by the time you're done with the rotator cuff repair.